Another thing that's really important are since the experience can kind of be death by a thousand cuts. Even some of the things that we experience that we don't think might be related to trauma, I think it's important to name that they can be. So even something like imposter syndrome, feeling like you don't belong in a space that you've, worked just as hard, gotten an education, did everything that anybody else should do to get there. Feeling that sense of imposter syndrome, that is an effect of internalized oppression and an offshoot of race-based trauma. Even something like rejecting ancestral beliefs or ancestral beauty, right? Like I said, going back to the piece around, hair care and texturism and colorism. All of these are an offshoot of internalized oppression. And also sometimes tone policing, right? Feeling like you are experiencing tone policing from other folks, or even how we engage in it in our own community, because that's an offshoot of feeling like, well, if we're all representatives, we all have to be perfect. But then perfect ends up being defined by white gaze. And so all of these things are connected to one another and important to think about. And so with all of that being said, right, obviously we want to think about, well, how can we move through these experiences in a way that prioritizes wellness? How can we move through these experiences in a way that's not just supportive of ourselves, but supportive of our community? And how can we really move towards healing? I think that that's really important. So one way to do that is to start to be aware and to start to acknowledge the ways that these experiences are so insidious. I'll even take myself as an example right now, right? I recognize in the beginning of this, I was using words like marginalized and minoritized a lot, and not specifically saying Black, Indigenous, people of color. And I don't know if you noticed, but I started to move towards that language because when we focus on the parts of our identity that certainly have been oppressed, we move ourselves away from the parts of our identity that have so much strength and that have so much presence and that should be seen. And even my lapse, right, in language right now is a part of a system, right, that has taught me how to talk about these things, right, that's given me this language. So even being conscious and from moment to moment can really shine a light on the small ways that we can start to institute healing. Along with that, being able to develop and implement communication strategies to address microaggressions and to address intrusions into our boundaries. Somebody came up with a phenomenal document that's literally, I think the title is Conserving Your Energy. And it's literally just like a list of common microaggressions that Black, Indigenous, and folks of color experience, and like a response to that. Like, so you don't have to think about it, so that you can have something that you say, and all of the responses are ways to both set boundaries, but also push the person you're speaking to educate themselves so that you're not holding the burden of that. So being able to think about either individually or in community ways to develop communication strategies that help you to address microaggressions and institute boundaries for yourself. Another way to interrupt microaggressions is something that we as mental health professionals hear about a lot. I don't know how common it is in, in society, but this idea of Socratic questioning. So questioning people in a way where you can identify the complexity in the thing they said, right? And so, for example, a common microaggression could be something like, oh, like you're so articulate, like that's so phenomenal, right? Being able to say, oh, well, why wouldn't I be articulate? Or, well, what did you expect? How did you expect me to sound? How did you expect me to relay that information to you? And then folks have to kind of sit with their own thought process, right? Or, oh, well, that's kind of you to say, but, I'm wondering, is that a common thing that you say to all presenters, right? Is that something that you would say to somebody who wasn't a Black woman? And so being able to kind of put it back on the person to think about the thing that they're saying and to have to identify and hold the impact that those words may have. Something else that we need to recognize is that we're being impacted internally. And so we may have negative thoughts and negative self-talk and negative emotions that are coming up for us and that we're holding on to. So being able to recognize them and being able to create the space to challenge any negative thoughts. And we can validate our feelings and our emotions without letting them consume us. And we can be mindful of our feelings and allow them to really fuel us. There's a great Instagram account, Decolonizing, I think it's Decolonizing Therapy or Decolonizing Mental Health, but they kind of speak about like that there can be beauty in rage, right? It can fuel us into action, and it can fuel us into empowerment. And so not being afraid of those feelings, letting them actually fuel us to see how we can become empowered. I know that this has been something that gets thrown out a lot, almost to the point now where it feels kind of like, pop culture-y. But self-care is really, really important, and significantly, self-care in the face of cultural and racial trauma is necessary. We need to attend to our physical, spiritual, and emotional mental health. Angela Davis had kind of said that she recognized that folks in the Black Panther Party, those who did turn to wellness and self-care turned to it later on, and she kind of thought about, I wonder what the movement would have looked like if we had really paid attention to how we were taking care of our bodies and our minds and how we were engaging intentionally in these spaces. That's something that's really, really important. And sometimes self-care is as small as limiting our exposure to triggering situations and conserving our energy. But sometimes our self-care is reaching out to community connections. So reaching out to folks who are doing social justice work that aligns with your mission, and reaching out to mental health providers and spaces that are also aligned. And so when you're seeking a mental health provider, asking questions about their thoughts on systemic oppression and social justice and racism, and how they infuse race-based and culture-based trauma in their trauma-informed work, and really being able to get a sense of how they are going to be able to support you. And then also being able to build community, whether it's with friends or family, being able to really create a space where we're talking about these things and not feeling like we have to hold on to them all by ourselves. Being able to find strong, positive cultural identities and representations that can really highlight our sense of self and really have us feeling like we're connected, not just to our present, but also to our history, right? Again, to that ancestry piece. And being able to activate allies/accomplices. So for folks who are in your life and calling themselves an ally, really being able to say to them, this is how I need you to show up for me. This is how I need you to stand up and be present. And so some of that weight is off of you. And then there are also some other great resources. The Institute for the Study and Promotion of Race and Culture has a racism recovery toolkit. So I would certainly advise that folks look into that. And then for people who want to be allies and accomplices, ihollaback.org. Exactly how it sounds. I holla back. If you were a fan of that Gwen Stefani song, you'll know how it's spelled. But they have a bystander intervention document. So also talking about how can you show up for people? How can you be present as an ally, especially like if you see something, being able to say something. And the last thing I'll say, and then I'll, I guess, kick it over if there are any questions, is to be kind to yourself, to be compassionate. If you're somebody experiencing these things, to recognize that there is a history of these experiences that far transcends what we can understand in one day, 1 month, 1 year, recognizing it as a growth-based process. And if you are someone who wants to be an ally, or you are a clinician, doing the research and recognizing that some of the traditional ways we have been taught are going to fall short. We're going to have to seek out